So, you're bringing your new baby home. It is one of the most incredible, exciting moments of your life. And, it can also be just a little bit overwhelming. If you're feeling that way, trust me, you are not alone. We're going to cut right through all the noise and give you a super clear guide to help you navigate these first few weeks with a whole lot of confidence. Seriously, pretty much every new parent on the planet has felt that same mix of pure joy and total uncertainty. This isn't about being the perfect parent, it's about feeling confident, and we're here to help you build that confidence one little step at a time. Okay, let's dive right in. We've broken this whole thing down into 5 key areas. Think of it as a roadmap for your first few weeks. We'll start with what to do when you first get home, then we'll tackle the big ones, feeding and sleeping. After that, we'll explore some of the interesting things about your newborn's body, and we'll wrap up with how to keep your baby safe. Part 1, the first few days. So, you've left the hospital, you've survived that first nerve-wracking drive home, and now you're walking through your front door. It's a pretty surreal moment, right? So what do you need to focus on right away? First things first, let's talk about creating your own little peaceful bubble at home. Your friends and family are going to be so excited to meet the baby, but listen, you are in charge. It is absolutely okay to say, not yet. Use these first few days just for you to bond as a family. Now, as for clothing, the golden rule is super simple. Your baby just needs one more layer of clothing than you do. It's also a great idea to have both newborn and 0 to 3 month sizes ready to go. And always, always choose comfort. Soft fabrics and easy snaps are going to be your best friends. Okay, this is a big one. Car seat safety is non-negotiable. And these 5 checks are so simple, but so important. First, no puffy coats under the straps. They compress in a crash and leave the harness too loose. Put the baby in first, then tuck blankets over top. Make sure the harness is snug, and that chest clip should be right at armpit level. The recline angle is also key for keeping their airway open. And last, do the inch test. Grab the seat at the base and give it a good tug. It shouldn't move more than an inch, side to side or front to back. Getting this right gives you total peace of mind on the road. All right, let's move on to part 2, all about feeding. This is probably the #1 source of questions and, let's be real, a lot of stress for new parents. So let's break it down. If you're breastfeeding, knowing these basics can make all the difference. Nursing on demand, which means every 1 to 3 hours at first, is exactly what tells your body to make more milk. A good latch is everything. It stops you from getting sore and makes sure your baby is actually getting the milk they need. And please don't be afraid to ask for help. Lactation consultants are amazing. And of course, you've got to take care of yourself too. Drink tons of water and grab those extra snacks. For anyone who's pumping, this chart takes all the guesswork out of storing milk. A really easy way to remember it is the rule of 4s. Freshly pumped milk is good for up to 4 hours at room temp and up to 4 days in the fridge. In a standard freezer, it can last for 6 to 12 months. Simple as that. And now for everyone's favorite topic of conversation, poop. I know, it's weird, but what you see in that diaper can cause a lot of worry. The truth is, there's a huge range of what's normal. Generally, a breastfed baby's poop will be looser, kind of seedy, and a yellow-green color. A formula-fed baby's poop is usually a bit thicker and more tan. The main thing to know is that what you're seeing is probably totally normal. Okay, next up, part 3, sleep and soothing crying. These two are so connected, right? A tired baby is a crying baby. Learning your baby's cues for rest is a game changer, so let's get into it. This might just be the single most important question a new parent can ask. Creating a safe place for your baby to sleep is the best thing you can do to protect them while they rest. The rules for safe sleep are incredibly simple, and they save lives. Just remember, back to sleep. Always put your baby down on their back. They need to be on a firm, flat surface with nothing else in the crib. No blankets, no pillows, no bumpers, no toys. It's recommended that they sleep in your room for the first 6 months, but never in your bed. Following these simple do's and don'ts is the best way to reduce risk. When your baby just won't stop crying, it can feel really stressful. Remember, crying is just how they talk to us, so think of yourself as a detective. First, check the obvious. Are they hungry? Is their diaper wet? Are they overtired? Once you've rolled those out, you can try some other tricks. Sucking is super calming for them. You can also try to recreate that cozy feeling of the womb by swaddling them up and making some loud shushing sounds. And of course, never underestimate the power of motion. A little rocking or a quick walk outside can work wonders. All right, part 4, your newborn's body. Think of this as a quick little owner's manual for some of the unique and, let's be honest, sometimes surprising things you might see. It's all just part of their amazing transition to the outside world.
A lot of these common newborn things can look a little alarming, but they're usually just temporary and totally harmless. Baby acne, super normal. That flaky stuff on their scalp called cradle cap, it'll go away. The umbilical cord stump just needs to be kept clean and dry and it'll fall off on its own. And things like swollen genitals or bowed legs, that's just leftover from being curled up in the womb. Bottom line, it's all normal and it all passes. And now for our final section, and it's a crucial one. Keeping your baby safe. This isn't about making you anxious. It's about empowering you. Knowing when you should call for help means you can act quickly and confidently when it really matters.
Okay, this is a number you need to remember. 100.4 degrees Fahrenheit, which is 38 degrees Celsius. If your baby is 3 months old or younger, a rectal temperature of 100.4 or higher is considered a fever. This is not a wait-and-see situation. It always means you need to call your pediatrician right away. Besides that specific fever number, here's some other key signs it's time to call the doctor. If your baby just refuses to eat, or if they're so sleepy you can't seem to wake them up, make the call. Same if they're crying in a way that's just inconsolable and not like their usual cry. Very watery diapers or a concerning rash are also good reasons to check in. When in doubt, just trust your gut. You know your baby best.
So we have covered a lot, right? Feeding, sleeping, car seats, when to worry. We've gone through so many practical tips for taking care of your baby. But after all of that, what is the single most important piece of advice we can give you?
It's this. Be kind to yourself. The learning curve is so steep, you're going to be exhausted, and you won't always have all the answers. And that's okay. You are exactly what your baby needs. Give yourself some grace, ask for help when you need it, and please remember that you are doing an amazing job. You've got this.